It is more important right now than it has been for years because there is a measles outbreak on the East Coast. Tonight, the CDC is warning health providers to beware because vaccination rates have dropped across the country. It wants 95% of school kids vaccinated, but here in the Southland, we found 350 schools below that, some well below that. And even the most experienced doctors here are worried this nightmare from our past could soon revisit us.
It's one of my earliest memories.
He was only 5.
The fever and the cough and the itchy rash.
When a rash and red bumps changed his reality.
And I vividly recall the night when my fever was high, the spiders were attacking me, and it was as real as I can remember it to be.
Now, more than 60 years later,
obviously it was a hallucination.
Stephen Nishibayashi remembers it.
At the moment, it was very, very scary and frightening.
As the moment his thoughts turned to medicine.
It was a constant reminder of my motivation, or part of my motivation, for becoming a pediatrician, to prevent preventable illnesses.
Physicians today know that measles is more than a nuisance.
By 1963, a new vaccine eventually did make measles preventable. And with his own injections, Dr. Nishibayashi did save thousands of children from suffering the same, sometimes fatal nightmare.
And you certainly saved a lot of pain and suffering.
Absolutely.
But now, years since his retirement, vaccine absolutes have drifted into doubts, with sudden outbreaks across the world, one just days ago in Philadelphia.
The most recent outbreak in Philadelphia, all the cases occurred in unvaccinated people.
Could that easily happen here?
Yes.
Here in California, the state tracks vaccinations by requiring them before children can start kindergarten. By law, schools themselves must keep those records. But we've learned the California Department of Public Health is now auditing 450 schools for not having at least 90% of students fully vaccinated, 195 of those specifically for measles. 2 schools are at 0%, 1 at 9%, a tenth of all of them are under 75%.
It could spread really quickly if we don't have herd immunity.
Dr. Nava Yagani says 95% of students need to be vaccinated to have a herd immunity that would prevent a large outbreak.
Being below herd immunity, is that dangerous?
Yes, definitely.
Could it happen here?
100%.
Our analysis of data from the state of California gives us all sorts of information. For example, on this map right here, you can see that there are 350 schools in the Southland that are all below herd immunity. Each dot here on the map represents a single school with a vaccination rate below 95%. And the larger the dot, the larger number of students that are unvaccinated at that school. There are 50 schools in Orange County, 41 in San Bernardino, 32 in Riverside, and 18 in Ventura County. In LA County, there are 209 schools below herd immunity, and 61 of them are at LAUSD. The county's numbers are actually even lower than that, even though they also include daycare centers.
We have about 80 that are less than 90%.
Is that concerning?
It is definitely something that we're trying to address.
And the data itself may need to be addressed. The state's most current numbers are a snapshot taken from October 2021 to March 22. And the data says LA's Arts and Action Community Charter School only had 70% of its students vaccinated.
But that 70% is not what we report.
You don't think that's correct?
No, it's not.
The school showed us its data with a current vaccination rate of 98.6%, up from 98.4% last year.
We have a very thorough student enrollment registration process, and we have all families submit vaccination cards, and students are not, allowed to register unless they fulfill that. So under 70%, I'm not sure where that data is coming from. If it's coming directly from the state, it might be that the data is off or there's an error in reporting.
The state later confirmed, though, that the school did report 70% for the 21-22 school year. The school later clarified that there were paperwork issues preventing them from reporting anything higher.
You have to get vaccinated in order to attend school, and it is a law here in California.
The law may be clear, but accurately tracking the vaccinations gets murky.
But whose job is it? Is it the school's job?
It's the school's job.
It's the school's job?
Yeah.
So some schools just aren't doing the job.
There's just maybe they don't have the lack of resources.
Are children's health at stake?
Yeah, exactly. And I think that's the discussion we're having.
Whatever the reason, the health department does believe the numbers are generally reliable, that the danger is real.
Are you worried there could be an outbreak?
I definitely am worried, and I think that we really need to do whatever we can.
You're going to get a shot today, but it's good for you.
Worry only strengthening their will to have free county immunization clinics like this.
Yay! Good job, Noah!
Mother Tiffany Chow hopes it'll get better by the time little Noah here goes to school.
So as a mom, what do you think? Is that troubling?
Yeah, I think so. He still has a couple years. I can only hope that it gets better.
Should parents be worried about the safety of their kids, the health of their kids?
Oh, I think yes, without a doubt.
It's an illness doctors thought had been left in the past.
It was a different world when that young boy was smiling.
It was a different world.
And an illness that years of experience have taught this doctor to take seriously.
You survived the measles, so why does any child need to be vaccinated?
I survived. Many survived. The complications are rare, but if it happens to your child...
In the rare case of complications, there can be death, but that truly is rare. The CDC says it's only about 1 out of 1,000. We did reach out to our largest school system, LAUSD, and they say their chief medical director was unavailable to speak about this. And LAUSD did not answer most of our questions. But in general, when we contacted schools in every county in our area about low vaccination rates, almost all did say it was corrected as soon as they were notified. You can protect yourself by asking your own school what the vaccination rate is. That's the most accurate way. Or go to kcalnews.com, where we've made an interactive map for you to see the state's most currently available data. I'm Ross Palumbo, KCAL News.